So now we had seen about the various cells of the immune system. Now let's see about the activation of the immune system. So whenever there is an antigen entering into the body, suppose there was a cut in the skin and the antigen has entered into the bacterial antigen, suppose it has entered into the skin. So what happens, there will be antigen presenting cells present at the site of entry itself. So we have various types of antigen presenting cells. Let's see about later. So in the skin we have Langerhans cell, which is a dendritic cell or an antigen presenting cell. So this antigen presenting cell will take up this antigen. It will then break it into smaller substances, process it, and then it will attach it with the MHC complex. So it will attach it and then it will bring this complex to the membrane of this antigen presenting cell. Now with this MHC complex attached with this antigen, it is going to enter the blood and reach the T lymphocytes. So to the T lymphocytes, they will be presenting it. So when it presents to the T cells, in the context of MHC1, it is going to present to the cytotoxic T lymphocytes, while in the presence of MHC2, it is going to present it to the CD4 positive T helper cells. So that will again result in the T cell activation. That much we had understood, right? So let's see about the various antigen presenting cells now. So we have two types of antigen presenting cells again, which are professional antigen presenting cells and then non-professional ones. So professional ones are going to have lots of MHC expression. So lots of MHC expression in the sense they are going to have a lot of affinity as well. So these professional APCs are more potent, while non-professional APCs, even though they have MHC complex expression, but they are going to be present in lesser amounts. So they are going to be less potent compared to the professional APCs. So the examples of professional APCs are various dendritic cells like the Langerhans cells, which are going to be present on the skin. And then we also have the follicular dendritic cell. Follicular dendritic cells are present on the follicles in the lymphocytes. Okay, so two types of dendritic cells, Langerhans cells and the follicular dendritic cells. Then we have B cells, which is again a professional antigen presenting cell. Then macrophages are also antigen presenting cells. So under non-professional APCs, we have thymic epithelial cells, thyroid epithelial cells, endothelial cells, and skin fibroblasts. So only when needed, they are going to act as antigen presenting cells. So these four are again examples of non-professional cells, which are MCQs.